Welcome to This Week in Health IT News, where we look at the news which will impact health IT. This is another field report where we talk to the leaders from health systems on the front lines. My name is Bill Russell, Healthcare CIO coach and creator of This Week in Health IT, a set of podcasts, videos, and collaboration events dedicated to developing the next generation of health leaders. As you know, we stepped up production over the last 3 weeks, and Sirius Healthcare has stepped up to sponsor and support This Week in Health IT. I want to thank them for sharing our passion to capture and share the experience, stories, and wisdom of the industry during this crisis. Today, Drex DeFord conducts the field report for This Week in Health IT. Special thanks to Drex for helping us to cover more ground during this time. If your system would like to participate in a field report, please shoot me a note. And easiest way to do that is by email bill@thisweekinhealthit.com. Now, on to today's report.
Hey, everyone, and welcome to This Week in Health IT. I'm Drex DeFord, CI Security's Chief Health Strategist and President at Drexio Innovation Network. Today, we're with Mitch Parker. Mitch is the Executive Director and CISO at Indiana University Health. Welcome to This Week in Health IT, and thanks for being with us, Mitch. I know that you guys are crazy busy.
Thank you very much for having me.
For sure. I'm just going to hit a few questions. We're going to try to keep it short because I know you got to get right back in the ball game. But let me start with, what are you seeing with regard to threat activity during the pandemic?
I'll be very clear about this, is that we've seen an uptick, like everyone else, in spear phishing attacks. That has been the major focus that we've observed. Huge amount of domains being registered to look like COVID-19. Also, we're seeing a number of attacks about fake donations and a lot of donation scammers. I've even personally been contacted by someone offering me surgical masks. I'm sure at a pretty high markup.
2 or 3 times I've gotten emails like that too. What, I mean, are you getting emails from folks on the staff who are kind of saying, you know, well, what is this? Is this real or not real? Or are you just kind of blanketing everybody regularly with some updates?
Well, we blanket everyone regularly. I mean, that's just what we do. Obviously, we've had to up our game a little bit with what's going on and also with a huge amount of people working from home. But in general, I mean, just in the industry, everyone's been getting these emails talking about how much everyone's been getting these emails and talking about how much they are just getting slammed with scam emails.
Yeah, for sure. Any other specific threats you're keeping an eye on? Any other things you are thinking about or worried about?
Like everyone else, I'm just worried about criminals using this as an opportunity to take advantage of stretched organizations to make their mark. Yeah.
There's a lot of activity right now, a lot of stuff happening in health IT. How have you been able to keep security integrated into the process? You know, how do you balance we have to be responsive versus we have to be secure and manage the risk? What's your approach to that?
The truth is, we've done a lot of work in pre-qualifying a number of solutions that we already had. So it went to the point, and I had this discussion earlier today about being able to pull solutions off of the shelf that we could use to say, okay, you need a solution. We have something here. This is what we recommend. This is what works. And we've had to be very flexible and cut down our time to evaluate solutions. That doesn't mean we don't evaluate them. It means that we do it on a much shorter time frame than we used to do.
Are there things you leave out of the process to cut down the time frame, or you're really just brute forcing it?
Pretty much brute forcing it. Because I can tell you, a lot of our vendors have been very good about providing good security documentation and attestations online.
Yeah.
We've been utilizing a number of those.
Yeah.
So I'll give you an example. I did a contract for someone last week, and we were able to cut through it because it turns out the platforms they were using were already ISO certified.
So you were able to just pull that data, pull those documents down and use those for all the reference questions that you probably would have bludgeoned them with otherwise.
Yes, and the other part of it is they needed to have a line in their contract about support, and I was able to use the ISO certification, craft some language, and got it past our lawyers and theirs.
Great. Fantastic.
Usually that takes about a week or two to do because, well, lawyers, and it took us 48 hours to get that turned around.
That's awesome. That's terrific to hear. Hey, there's a lot of new stuff that's been rolling out, and it sounds like you're mostly trying to focus on stuff that you already have contracts with, stuff you already have in-house. But Zoom, more personal devices, you undoubtedly have pushed a bunch of people to go work at home. How are you dealing with that? How are you dealing with all that sort of new world order of what's happening right now?
So the big challenge was with telemedicine. Because we have to give good guidance to people that are using these new solutions because OCR relaxed their enforcement.
Right.
And so we had to reiterate to people, this isn't saying, hey, you can go use free Zoom. This is, you've got to enter into these relationships as if you were going to be getting a BAA with them. We're just going to not enforce if you don't have one, not enforce if you haven't done a third-party vendor risk assessment. But we want you to anticipate getting that BAA and doing the groundwork. Just get it out on the ground now. So we've had to provide that level of guidance. I did some work with John Lynn, put up an article on Healthcare IT Today, specifically referencing what providers needed to do. Because the first thing that happened is InfoSec Twitter lit up saying, hey, look, OCR says you don't need security on telemedicine.
Yeah.
Which was not the case. And then we were a little bit unconventional about talking about what applications can be used because realistically, there's some vendors out there that are never going to enter into a BAA. Like I don't anticipate Signal entering into a BAA to use their app in telemedicine. However, I feel a lot better about using Signal for telemedicine than I do some of the other apps out there.
Yeah. Yeah, it's going to be interesting to kind of see what happens as we get into this a little bit further. Will they continue to extend? I'll ask you, what do you think? Will they continue to extend these sort of waivers? Or at some point, will they start to set dates about now you have to come back into compliance? And how will all that work?
I think they're going to set dates for coming back into compliance. They've been good about setting dates lately. Take a look, for example, at the 21st Century Cures Act final rule. They're going to set dates when this is over to say, this is a date by which you need a BAA for your telemedicine solution. However, what I think is going to happen is that they're going to expand the list of applications you can use to be more than just CC HIT certified. I think you're going to start seeing more common platforms approved for telemedicine.
Yeah.
Because there's ones out there that are pretty simple that you can use that happen to have things like high trust certifications, such as Microsoft Teams.
Right, right.
So I think that's where we're going.
How about the work from home stuff? Is that keeping you up at night? Have you had to do anything different or interesting to support more folks at home?
I think the issues are not with technology as much as they are with the logistics of taking a huge workforce that has never worked from home and getting them to work from home in 2 weeks.
Yeah. What a challenge, huh?
Because if you think about it, the biggest challenge we had with work from home for doctors was the second we rolled out EMRs. Because every doctor had the chart at home at night.
Right.
Because I remember my big challenge with remote access was at my last job when I was at Temple Health. They rolled out the EMR that shall not be named for outpatient, and the next thing you know, I had 250 doctors going to me going, hey, Mitch, how do I get Citrix set up? I need the chart at night.
Yeah.
And so I think for doctors, we already had it pretty well nailed down because of EMRs. But it's the rest of the workforce that isn't IS, that isn't the medical staff, that has to adapt. And that's where we need a lot more hand-holding. However, it's out of the bag now. And I think when you take a look at costs in healthcare, if I tell any CFO out there, I can save you 20% because if I have half the staff work from home, I don't have to build real estate, or I can take real estate that people are in now and repurpose it for patient care. Any CFO is going to look at you and go, are you crazy?
Yeah.
We're going to work from home.
Yeah. Yeah, I think it's funny. I was talking to somebody the other day and they were saying, I don't know how we're going to get everybody to come back, how we're going to get everybody to come back from a telemedicine world and from a work from home world. And then that was quickly followed by and I don't know that we want to bring them all back, so thoughts about that?
And that's the truth. You take a look at where things are going in healthcare. The curve is going between inpatient and outpatient, where in a few years, we're going to have more outpatient than inpatient. And so therefore, you're going to have less of a demand for inpatient space and more of an emphasis on getting people back in the community and monitoring them at home.
Right.
I think this current crisis, what it's done is it's moved that time period up significantly. I'd say at least 2 to 3 years. And I think also when you take a look at what hospitals are spending on new facilities, I mean, it's a lot of money.
It's some of the most expensive property in the world, right? I mean, inpatient facilities per square foot is massively expensive. So maybe we've come up with another way to solve that problem.
And I think realistically, you have to think of it as something I learned from a CISO at another institution a few years ago. You reserve the hospitals for the sickest of the sick.
Right.
And find other ways to care for those who don't need it, don't need that full inpatient stay. And I think what's going to end up happening is that we're going to leverage IoT and we're going to leverage the hospital command center model that Hopkins pioneered, and we're going to use that to take care of patients. And it'll take care of a lot of them. And that command center model is going to expand to outpatients.
Mm-hmm.
We're going to do a lot more monitoring for compliance at home. In inpatients, that's never going to go away, but it's going to change. We're going to have less of it. And and I've read the reports from some of the big four firms, everyone forecasts less inpatient beds. That's going to happen. Also with medical offices, office space is expensive. I want to use every single solitary inch of that building for patient care to maximize those costs.
Yeah.
If I get someone working remotely and use that space for patient care, my revenue for square foot goes up.
Yeah.
If I don't have to put in for a cube farm or other office space, because again, some of the office space out there, some of my peers at academic health systems on the East Coast, that's the most expensive office space in the world you're talking about.
Definitely.
The health system doesn't have the revenue of the management consulting company that's leasing space in the same building.
Right.
So,
sorry, go ahead.
Go ahead. I'm sorry about that, Drex.
Oh, that's all right. I was just gonna ask you real quickly about any best practices to other stuff that you've come up with that you've implemented from a cyber perspective over the last few weeks that you'd like to share with folks who are listening?
I think the biggest thing you can think of is to get in place a program to do threat intel. My advice to every organization, HISAC has free memberships. Please take advantage of those. I
saw you post that on Twitter the other night.
Yes.
Yeah, thanks for doing that. Anything I didn't ask you about that you want to add?
No, I'm good. Thank you very much.
Okay. Hey, I really appreciate you being here. Again, I know you're super busy, crazy busy. Thanks for being on, and we'll catch up with you again soon.
Absolutely. Thank you so much, Drex. Have yourself a great day.
You too.
That's all for this show. Special thanks to our channel sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and Pro Talent Advisors for choosing to invest in developing the next generation of health leaders. If you want to support the fastest growing podcast in the health IT space, the best way to do that is to share it with a peer. Send an email, DM, whatever you do. You can also follow us on social media, subscribe to our YouTube channel. There's a lot of different ways you can support us, but sharing it with a peer is the best. Please check back often, as we will be dropping many more shows until we flatten the curve across the country. Thanks for listening. That's all for now.